I'm going to talk about a different approach to conquer a moderately hard cataract. Well, we all know that these hard cataracts typically have a thin capsule, a little cortex, and three layers of the nucleus. The first layer is the thin epinucleus, there is a firm inner nucleus, and a hard amorphous central core. And the essence of phacoemulsification surgery, as we all know, is to disassemble the nucleus of the crystalline lens and emulsify these small pieces within a safe environment, without interfering with the structural and functional integrity of the other ocular structures. Now, we have heard about chopping, and as we all understand now, that vertical chopping is commonly used for all these hard cataracts, although conventional techniques of chopping brunescent cataracts still remains challenging in most cases. Well, in this approach, we tend to make a fairly large capsular excess, then a hydrodissection and a nucleus rotation, and then the phaco tip is impelled in to the center of the nucleus, and with a sharp chopper, we make a vertical chop, thereby to make or to initiate a crack in the peripheral part of the nucleus. And these processes repeated 5 to 6 times so that multiple small cracks are made in the periphery of the nucleus, and we all know that these cracks will not reach the posterior plate, but then they will make a flower petal-like appearance because there are multiple small cracks which do not extend to the posterior plate, but they extend to the periphery. And in the process, actually, we separate and expose the central hard core of the nucleus, which can be very easily emulsified within the capsular bag. This is here to show that how it can be easily taken out, and just to demonstrate that it can be taken out. Once it's emulsified within the bag, we have created a lot of space within, and then holding we can laterally separate these cracks so that these cracks can extend to the posterior plate, thereby separating the cracks, and each crack, when they proceed to the posterior plate, when they extend to the posterior plate, the pieces will get separated like pieces of pie, and each piece can be separately emulsified. Well, this is just to show that we need to make very small pieces, otherwise the large pieces are difficult to manipulate, and the sharp tips of these large pieces can damage the posterior capsule or the endothelium as well. Well, this is an animation to show this technique. We impel the nucleus at the center with the phaco tip, and then create small cracks by using a vertical chop technique, and these cracks do not extend to the posterior capsule, but they loosen up the inner hard core of the nucleus, which can be emulsified. And by lateral separation movements, we can extend these cracks to the posterior plate and then separate each piece. Well, the advantages of this technique is that there is minimal stress on the zonules, there is low vulnerability of the posterior capsule, and the most dense part of the nucleus can be emulsified within the bag. And so the collateral damage of the US energy is really minimized. And another advantage is that we do not need any new technology or a new instrument to learn this or practice this process, this technique. And of course, you can expect very consistent outcomes in these hard cataracts with this technique. Well, in our small case series, we have seen that the corneal endothelial cell loss was 9%, which is comparable and very much acceptable. This is one of the publications showing similar techniques, wherein they have very elegantly described that most conventional nucleofractis techniques would involve the cracking through the radial lines. But then there are bridging fibers networks which resist this separation. And in this technique, we use lamellar separation, which becomes easy because these are loosely adhesive tissues. The inner hard core of the nucleus is loosely adhesive to the peripheral epinucleus. Well, to summarize what we have said all this time is this technique involves impelling the nucleus at the center, making small cracks in the periphery using vertical chop technique. And then what we do is we make multiple such cracks. This loosens up the central core, the hardest core of the nucleus, which can be emulsified within the bag. And after emulsification within the bag, we have a lot of space. Here you can see the separation is actually dislodging or separating the central hard core of the nucleus, and which can be very easily picked up and emulsified. But then we need to make sure that we make multiple such pieces to loosen up the nucleus. That is the key to this technique. And once we can take out or separate the nucleus, you can see now that once it is separated, it can be emulsified within the bag. Well, this is how it's taken out here, and it's being emulsified. And once it's emulsified, we have a lot of space, and lateral separation can be done at multiple levels. That will come next. Here it has. We have taken it out to show that it's separated absolutely the inner dense core of the nucleus. And then once it's done, you can see there is a lot of space within, and there by lateral separation at multiple levels, you can extend the crack to the posterior plate, wherein each piece gets separated here. Here it is, and we have done it in a second attempt at a different level. So we can use multiple levels for separating these pieces, and then emulsify each piece, and then we can implant a lens. Thank you.